Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Vitamin A deficiency. The dose of vitamin A deficiency in infants it is 300 to 400 micrograms. In children it is 400 to 600 micrograms, and in adolescents vitamin A requirement is 750 micrograms. Deficiency of vitamin A. Vitamin A deficiency is seen in follicular hyperkeratosis and or increased urinary tract infections can occur, or there can be eye changes are seen in vitamin A deficiency. Eye changes like delayed dark adaptation and photophobia are seen. Eye changes can appear after 2 years, or night blindness can appear after 2 years. According to WHO classification, X1A for conjunctival xerosis, X1B for bited spots, X2 for corneal xerosis, X3A for corneal ulcer, where the corneal ulcer is seen less than one third of cornea, X3B for corneal ulcers, where corneal ulcer is more than one third of cornea, XN night blindness, XF fundal changes, XS which is corneal scarring. Treatment of vitamin A deficiency is vitamin A can be given orally by 50,000 units, that is between 0 to 5 months of age, or we can give 1 lakh units of vitamin A by 6 to 12 months of age, or 2 lakhs units of vitamin A by more than 1 year of age. On day 0 or next day and 14 days, we give this vitamin A dose is given on 0, 1 and 14 days. Parenteral therapy is given if there is any cloudy cornea. So classification, X1A is for conjunctival xerosis, that is dryness of conjunctiva. X1B, if you can see bited spots. X2, there is corneal xerosis, that is corneal dryness is present. X3A, there is, if this is the cornea, there is a corneal ulcer, but it is present less than one third. If it is more than one third, then it is X3B. XN, that is night blindness. XF, fundus of the fundal scarring, fundal changes are seen. XF, fundal changes are seen. XS is for corneal scarring. S for scarring.
thank you and thank you for watching.